Hello and welcome to Reason News. The South African government is closely monitoring the emergence of a new COVID-19 variant known as NB181 or Nimbus, as global health authorities warn of its rising prevalence in parts of Asia and beyond. While the variant has not been detected in South Africa, officials are urging vigilance and continued adherence to basic hygiene practices as the country enters the winter season. The NB181 variant, also called Nimbus, is a descendant of the Omicron lineage and was first detected in Asia in January 2025. The World Health Organization designated it a variant under monitoring in May after it was linked to a rise in COVID-19 cases in countries such as India, Thailand, Indonesia, and China. As of late May, it had been detected in 22 countries and was responsible for an increasing share of global cases, rising from 2.5% to 10.7% of all sequences submitted to international databases between April and May. South Africa's cabinet has assured the nation that the government, through the Department of Health and the NICD, is closely monitoring the global spread of NB181. Health Minister Dr. Motsoaledi emphasized at the recent G20 Health Working Group in Johannesburg that the country's robust surveillance systems are systematically testing for key respiratory viruses, including SARS, CoV-2, influenza, and RSV. Currently, there is no evidence of NB181 in South Africa, and the number of COVID-19 cases remains very low. However, testing and sequencing are limited, and officials caution that ongoing vigilance is essential. Here's a video from the SABC News.
We can confirm that COVID-19 has never been eradicated. It was just declared that by the World Health Organization, I think years ago, that it was no longer public health emergency of international concern. So COVID will be with us. All that I always encourage people to say those preventative methods that we used to preach during the peak of COVID-19, they are still applicable even now. So we can prevent not only COVID-19 but other respiratory diseases like flu. As you know that during winter season in South Africa, it's also a flu season. So we can prevent further spread of COVID-19, flu, and other respiratory diseases if we maintain those protocols, which include maintaining personal hygiene at all times, meaning washing our hands with water and soap or using the sanitizer. We say avoiding close contact with anyone who is sick, who displays symptoms which are similar to COVID-19 or flu, symptoms like your headache, your fatigue, your body pains, your cough, your sore throat, and fever. But also in terms of face masks, face mask is not a mandatory currently in the country and other parts of the world to wear a mask when you go to public spaces. But for those who go to crowded spaces where they feel uncomfortable, they can safely wear the mask just to protect themselves against infection.
Preliminary data indicate that NB181 has mutations in the spike protein that may increase its transmissibility and allow for marginal immune evasion compared to other circulating variants. However, there is no evidence at this stage that it causes more severe illness or different symptoms than previous Omicron subvariants. Symptoms reported in Asia include sore throat, fever, cough, and fatigue, similar to previous variants. Some patients have described sharp throat pain and swollen glands, but there has been no significant rise in hospitalizations or deaths attributed to the variant so far. Government officials are urging South Africans not to panic, but to continue practicing good hygiene, which is wash hands regularly with soap, cover your mouth when coughing or sneezing, wear a mask if you have flu-like symptoms, stay home when unwell, and avoid unnecessary handshakes and close contact, especially with vulnerable individuals. These simple measures remain effective in reducing the spread of all respiratory illnesses, especially as the country experiences a seasonal rise in influenza cases. Health Minister Motsoaledi has emphasized that the country is well prepared to manage any rise in cases and that updated vaccines remain effective against the new variant. South Africa's National Institute for Communicable Diseases continued to monitor the situation through its Sentinel surveillance program, which systematically tests for respiratory viruses in both public and private healthcare sectors. The Network for Genomic Surveillance in South Africa is also actively sequencing samples to detect any new variants that may arise. Globally, NB181 is being watched closely as it spreads across Asia and has now been detected in the United Kingdom and the United States. The World Health Organization considers the public health risk of this variant to be low at present. Experts caution, however, that viruses can change quickly and continued monitoring is essential to respond rapidly to any shifts in transmissibility or severity. South Africans are urged to remain calm, stay informed, and continue with the preventative habits that have proven effective throughout the pandemic. The government and public health authorities will provide updates as more information becomes available and will act swiftly should the situation change. While the NB181 COVID-19 variant, also known as Nimbus, has raised concerns internationally, it has not been detected in South Africa. The government is monitoring the situation closely and the public is advised to maintain good hygiene and stay alert as winter brings increased respiratory illnesses. We will continue to bring you the latest updates and expert analysis as the situation evolves. Thank you for joining us. Until next time, stay informed, stay updated, and stay curious.